Thank you. So, Dr. Umar, please have your 15 minutes, please.
Okay.
Thank you.
It's a privilege to be here to speak to you on what we are doing in Nigeria, especially under the National Primary Healthcare Development Agency, which is a parastatals under the Ministry of Health in Nigeria. Our discussion today is on the strengthening the human resource for health, especially as regard to supply chain management. And we use that method very specific, that is engagement of the stakeholders, both in-country stakeholders and partners, in order to strengthen our human resource. The outline, we are going through the background of the country, and then we look at the structure of supply chain, what we are currently using, and then we also look at the framework of engagement of the stakeholders, and finally we look at the successes and then conclusion. As a background, Nigeria is a very huge country. You had that yesterday for those who are here. We have about 174 people with about 250 languages. So it's a very complex and dynamic country. Specifically, to underscore the issue of logistics, we deal with over 25,000 health facilities that delivers immunization. So getting vaccine and devices to those areas is a huge challenge. We also have about 210,000 liters capacity of cold rooms, which are spread throughout the country in 6 zones. We have 6 zonal arrangements in Nigeria. We have the central national strategic cold stone located in Abuja, which is the capital. We have other 6 bigger stores in the whole region. That is the initial system, but we have to reform it due to some reason which I will discuss later. Now, what happens in 2013 became a trigger for a lot of initiative and transformative agenda. We started with the leadership. We have discussed that clearly by Dr. Mahmoud yesterday, the leadership reform, but now I'm looking at specifically the human resource reform. So in 2013, immunization effective vaccine management assessment was conducted. We did not score very well, and that we take it in positive light. We didn't see it as an indictment, but it's a call for action. So first of all, we look at our plan. So we developed the National Routine Immunization Strategic Plan from 2013 to 2015. The goal of that plan is to have 100% bundles of vaccine and devices at all levels of the system, both at national, state, local government, and service delivery level. We also aim at, in the next cycle of the immunization, emergency vaccine assessment, EVM, will have over 80% success rate. With that goal in mind, a lot of other actions follow, especially the transformation agenda that starts with leadership and then the health workforce. We did a mapping of all our stakeholders at national, state, and local government levels. We also provide an enabling environment where supply chain issue became a current agenda for discussion at all the meetings, but at the ICC level, that is inter-country coordinating level. We have the core group. The core group happen to be technical team, while the look at my eyes is giving me someone. Okay. Oh. The steering committees. At the steering committee level, we have 2, both the technical and political team combined, so that because most of the decisions have to be approved and agreed upon by the political leadership, while the technical team decide or provide the necessary suggestions and recommendations. So out of that, we then develop the National Logistic Working Group. Under that, we have the Zonal Logistic Working Group, and then the third level is the state level working groups. We have other working groups like Routine Immunization Working Group, we have the M&E Working Group, and National Advocacy and Social Mobilization Working Group. Realizing that after leadership, the next key is those to do the job, and that is the human resource. And we need the human resources are key because they are the ones to use the tools and to ensure that products are available at service delivery areas. We also need to have the right mix of human resource in terms of training, motivation, and skill. We also have to have the change attitude. So to do that, we develop 3 cadre of action. One usually is for the short time, the intermediate time, that is the mid-term plan, and then a long-term plan to address the human resource issues. The mobilization of stakeholders happen to be our key short-term goal to rapidly developing the skill and capacities of our human resource for health, starting with national stakeholders, that is states and local government. We advocate to them for hiring and retention of key staff, and then training of those key staff for the specific functions they are supposed to carry. Before that, we implement our accountability framework. What does that mean? Is that the key activities from the arrival of vaccine or devices in the port down to the service delivery area were clearly documented, and responsibility were assigned to individual person and held responsible for his action or inaction on that key step. That is what we call the accountability framework. We also look at, as a mid-term, we look at the policies and plans towards the retention, remuneration, and improvement of the supply chain professionals. For example, now in Nigeria, the procurement cadre has been recognized. You can now rise from at a starting level up to the Director General, which is equivalent to permanent secretary level. So that cadre for procurement is there and approved and is ongoing. While the next level is to now bring in the supply chain managers, because procurement and supply chain are supposed to be integrated together. They are not separate activities, but they are actually together. So we are working towards bringing in other cadres so that they will be recognized, and a cadre will also be recognized, and so that one can aspire to move the ladder down to that to the highest level. We also, as a long-term arrangement, we are looking at collaborating with institutions to create mechanisms for learning and sharing information and professionalization, so that people can go for master's degree in supply chain management or even PhD, so that they will come back and move through the system, improve capacity of others, and also aim as a professional line. So we are looking at various institutions, especially one in South Africa, where we have started collaborating and discussing so that those cadres can be trained and they will be back and continue working in the system. All right. I've discussed this already. Okay. Good. To do this, we require a system for coordination and leadership. and therefore the management created logistic and health commodity department out of the procurement unit and department of disease controls and immunization. So those functions that usually the procurement directorate is doing in terms of logistic management was now given to this new department, and also part of the activities that the disease control and immunization department is doing was also combined, and a new department is created in order to articulate these short-term, mid-term, and long-term plans that we have for human resource for health. Coming back to our short-term strategy in terms of engaging stakeholders in order to increase or strengthen our human resource for supply chain management, is we have a clear mapping of all our stakeholders. We know their area of competencies and competitive advantages. We also know where they are working, either at state, at local government, or at national level. We also know the type of human resource they may be able to provide, and especially those that have funds for training, we request for them to support in training certain numbers of our staff in order to improve their capacity. And most importantly, we requested for secondment of experts from those partners who have long-term experience in supply chain to work with our staff so that mentoring and coaching can happen at the same time. And that happened at all levels of our program in terms of meetings, planning, supervision, and interaction, day-to-day interaction. So a lot of our staff are learning from that and putting back what they learn into action. We also receive support in terms of training of our health workers through either international or local training to improve their skill in supply chain management, especially the technicians, in terms of looking at our various equipments and supply chain equipment, the cold chain system, the cold room. So they were trained in order to fix those systems. Okay. The result of that interaction with the stakeholders leads to us now having trained over 12 national officers and partners in vaccine management assessment. So now we don't need many external people to come and do that. We already have homegrown officers who can do that. In fact, currently they are conducting one at national, state, and local government. We also have sent 4 national officers for training on fourth chain studies. We also have 8 national officers trained on the dashboard. We also have sent 2 of our staff for training as technician for SDD development. SDD means solar direct drive equipment. We procure a large quantity as part of the transformation agenda to improve our cold chain equipment. So we procured solar direct drive from Luxembourg, Dometic, and 10 of our technicians were sent there as part of the contract for training in order to manage those equipment and provide maintenance over a long period. We also, currently, next week, 6 more will go for additional training, and then they will form the in-country team to train other cadre in the whole 26 states. We also have sent 2 officers for training on logistics on the wheel. With that, they return and also train others. It's a training of trainers. Therefore, with this trained staff and improved skill, we now have transformed our distribution hubs. Initially, it was 6. Now we are limited to 3. This is to be more efficient. We have also trained result of our training has taken place. The first one is those that went for training for logistic management. You can see one of our staff there. And then others that went for Luxembourg training. He is now training others how to fix the panel. We also conduct a workshop for the new direct delivery to states, from state to the LGA, so that we shorten the hubs from 5 steps to 2. Initially, vaccine, drugs, devices arrive at national level, move to state, zonal level, from zonal to state, from state to local government, and local government to health facility. That long chain is very inefficient. So we now cut into 2, from the national level to a specific state. We call it one state level store that is qualified to hold those products, and from there directly to the health facility. So it's now from almost 5, 6 now to only 2 nodes of distribution. The same thing, we did the pilot in Lagos, in which the cold chain officers are trained on these new modalities, both at state and at the primary healthcare level and at the local government level. This is the one that was done also in Kano. So we look at the 2 biggest states, Lagos and Kano, and pilot that. So if it works in those big states, it may be able to work also in the smaller states. And it's working very well in those states. Okay. After that, we look at our also information system, and we launch in what we call a dashboard. This dashboard was launched in May, and by August, the result is very clear. We moved from 34% of local government with antigens in their stores to over 80% of all LGAs with adequate antigen in their stores from May to August. Okay. The goal for the vaccine and supply chain, as stated within our national routine immunization strategy, is to achieve 100% bundle of vaccine and devices at all levels, and to also attain 80% ABM standard. This is clearly indication that this will be achieved. There is clear indication that this will be achieved through the supply chain transformation program. As of now, we have 100% bundling at national. We have 100% bundling at states. We are trying to look at the tools to measure how we can assess the percentage of bundling at service delivery level. That we are discussing with our partners and other technical staff to see how best we can evaluate that stand. And finally, our immunization, routine immunization has increased from what it is to now over 80%. As a result of all these transformation agendas. And our fight against polio is winning. We are, as of now, we don't have Talk3 wild polio since 30 months ago. So we have only 6 cases of polio virus as opposed to many last year. So these transformation agendas has clearly been achieved. Thank you for your attention.
Very interesting.